magandang umaga, magandang tanghali, magandang hapon, magandang gabi po sa inyong lahat. Sa mga panig po kayo ng daigdig naroon. Welcome to our 179th episode of this webinar series. And thank you po for being part of our credible online community. And to all those who have just discovered us today, welcome po. At sana po marami po kayong matutunan sa ating webinar na pag-uusapan ngayong araw na ito. So for today, we'll be delving into multifaceted realms of women's health, fitness, well-being, beauty. Sa pag-uusap po natin, we'll aim to empower, inspire women, basically prioritizing holistic well-being. Pag-uusapan po natin reproductive health, obviously, hormonal balance, weight management, preventive measures, self-care practices, and overall fostering body positivity po, and providing a comprehensive guide almost sa ating women's health po. I'm Dr. Raymond Francis Sarmiento, Director of National Telehealth Center, National Institutes of Health, University of the Philippines, Manila. It's always a pleasure to be with all of you during our regular Friday, and also my pleasure and honor po to host this program. For today, I will be hosting this program together with none other than the PGH Coordinator for Training po, Dr. Dion Sakdalan. Dr. Dion.
Hello, good afternoon, Dr. Raymond. Good afternoon, everyone watching us from all over the Philippines and all over the world. So I'm really excited to be in this webinar and listen to our very renowned speakers to talk about reproductive health. Nakikita ko po sa ating mga audience, hindi lang po mga kababaihan na nandyan rin po ang mga kalalakihan, and hopefully you can also encourage other members of the family or your other colleagues in your workplaces to join us this afternoon for just 1 hour to talk about this very important topic, not just for women, but also for everyone else within the family. So good afternoon, Doc Raymond. So as we welcome our participants, not just here in the Zoom webinar, we also welcome those watching via live streaming on TVUP YouTube channel, and as well as those watching from TVUP Signal TV channel 101, and also from TVUP Facebook page and UP System Facebook page. We also would like to say hi and good afternoon to our, of course, distinguished guests from the Asian Hospital Medical Center, Drs. Anna Fe Garcia and Dr. Leonor Leonardo. So you'll see more of them later on as we introduce them to talk about our topic. I'm really quite honored to sit in for Dr. Susie Pineda. As you all know, Dr. Susie is now busier because she has been appointed to the second highest position in the World Health Organization Western Pacific region as a director for program management. So congratulations to Ma'am Susie. We hope we will be able to do a good job as we co-host with Dr. Raymond this afternoon. So as you have seen in our opening billboard, we changed or we tweaked our program a bit. We're now calling it Health Updates. And we have done a little reformatting for our program. But of course, we want to maintain the same high quality and level up to take a closer look at existing emerging health problems, not just COVID, here in the Philippines and the rest of the world. So for 2024, not just the format, but we also shortened it a bit. We want to go straight to the heart of the discussion. So our program will be a little bit shorter. But before we go and proceed to that presentation, Dr. Raymond, maybe we can introduce already our person on the street video.
Thank you, Dr. Dion. So for those who are joining us and making this sort of our New Year's resolution po, in this our second webinar for the year, we have what we call a person on the street video produced week in and week out by the TVUP crew. We try to take the pulse of the common folks on the street. Ano po ba yung alam po nila sa pag-uusapan ngayon ni na Dr. Ana Fe Gloria and Dr. Len Leonardo po. Hopefully, Dr. Len will be able to join us very, very soon. Ang tanong po natin sa common folks on the street are as follows. Number 1, sa palagay po ninyo, paano po mapapangalagaan ang kalusugan ng mga kababaihan? Paano nyo po ba masasabing malusog ang isang babae? At ano po sa tingin ninyo ang mga challenges or balakid sa pagkakaroon ng magandang kalusugan para sa ating kababaihan? Please watch this.
Siyempre, kailangan maging tayo sa katawan, malinis sa paligid.
I feel like as long as they remain mindful of how they're feeling and what's going on in their bodies and they immediately take action. That's one way they can do that.
As someone na may PCOS, na recently lang din na nalaman ko, and lagi ko na rin nakikita sa FYP ko kung paano ko ba talaga mapapangalagaan yung kalusugan ko. Siguro, isang step talaga na tinitake ay yung pagkakaroon ng active lifestyle din.
Siguro sa pangangatawan, nagdadala. Kasi hindi naman natin ng tao kung malusog siya o hindi, kasi meron naman maanang katawan na mahina ang katawan ko, ba? Meron naman na kagaya ko na tawag nito na hindi magpatabaan pero maliksi, walang sakit, healthy.
As cheesy as it is, I don't know, if they're happy and they feel like they can do all these activities on their own without stressing out.
Personally kasi, makikita ko sa sarili ko na malusog ako pag tinitingnan ko yung sarili ko sa salamin na hindi malalim yung eye bags, ganun, o kaya naman hindi laging puyat, o kaya naman yung menstrual cycle ko regular, like nasa tamang araw, nadadatnan sa tamang araw, ganun.
Kumain ng tama, huwag magpupuya. Isa pa yan na nakakaano sa kalusugan ng isang tao. Maging sa pagkain. Pagkain tayo ng gulay, hindi pa naikarni yung tuba. Kasi ang gulay, pagpapa ng buhay.
Siguro yung stress levels din, and yung sa pag-handle din ng hygiene, and yung proper hygiene din, kasi nadadaan din siya kung gaano ka ba ka-capable bumili ng hygiene na mga gamit. And
Well, for the most part, I really think it's just the buying of products like tampons or napkins. It's a lot and they're kind of expensive, but I really feel like those are one of the huge obstacles that they have to do. It'd be better if they were like cheaper or free.
naranasan ko na rin na kapag walang proper hygiene, talagang nagdudulot talaga siya ng UTI, o kaya naman nakakakati ng katawan or mga kaloob-looban, ganun. And ngayon, nagtatry din ako mag-invest ng mga proper na skincare, not only sa face, kundi sa body and lower body, ganun. Kaya mas mapapangalagaan din talaga yung sarili.
Thank you so much, TVUP. I found it interesting pa that we had, or at least we were able to get the perspective po from the male persuasion, and really trying to get more of the opinions po, especially from different demographics. So for our webinar for today, we'll be having our standard panel discussion format, and after our speakers have presented, that will be followed by a Q&A session. And for those who are asking, our certificates of attendance po, binibigay po siya sa mga nakapanood po ng at least 50% of the webinar duration po, no? So we have also noted that there are those who are asking for changes in the name dito po sa kanilang certificates of attendance. So that's also being done, or at least nagawa na po sa iba po. So we have already sent out for webinars up until webinar 178 po, no, which was 2 weeks ago. Lahat po ng certificates, and if you feel you should have received a certificate of attendance but did not, please email us at stopcovidex@up.edu.ph. So I think we should be able to go ahead with our webinar proper. Dr. Dion will introduce our main presenter po.
Yes, I'm very excited to hear her presentation to talk about focus on women, health, fitness, and beauty through the years. Please welcome one of our very good clinicians in the Asian Hospital and Medical Center Department of Obstetrics and Gynecology. Please welcome everyone, Dr. Ana Fe Ogloria. Doc Ana Fe, good afternoon.
Hi.
Yes,
Good
ma'am, we can
afternoon,
hear you, but we
everyone.
cannot see you po, ma'am, in your video.
There
we
you go.
Yes, okay.
Thank you so much for
Afternoon.
your very kind introduction, Dr. Dayon and Dr. Raymond. So, allow me to
Yes,
screen
ma'am, go ahead
share.
po.
Okay.
Go ahead, ma'am.
Okay. So my lecture for today will be about health, fitness, and beauty through the years. This will be my objective, which is to provide a comprehensive guide in maintaining women's health through prevention and proper health care. And this is the outline of my lecture. Basically, components of the recommended annual health visit with emphasis on the reproductive organs. Mainly the pap smear, the breast screening tests, ultrasound examination in gynecology, the CDC recommendations on physical activities, defining perimenopause and the menopause, and general advice on cancer prevention, as well as some practical beauty tips. For the annual Well Woman visit, what we usually do here is we discuss about healthy lifestyle and how to minimize health risks. Of course, we want to promote preventive health practices, and we perform or provide age-specific screening, evaluation, counseling, and updating the immunization of the female. Apart from taking a comprehensive history and vital signs, we will also compute for the basal metabolic index or the BMI. And then, of course, perform indicated physical examination. I adapted this table from the Philippine Society of Climacteric Medicine. So as you can see in this table, they provided the appropriate or age-specific examination, screening, and immunization for all the age group. So for all the age group, basically, as I said, we take the vital signs and do the physical exam. And we start the clinical breast exam at the age of 20, and this can be done every 1 to 2 years. But for those who are above 40 and beyond, we have to do it annually. For abdominal exam, we do it in all age group. And for the pap smear, we basically start doing the pap smear at 25 years old, and this can be done every 3 years, depending on the kind of pap smear that we do. But for those who are 40 to 64, we advise co-testing with HPV DNA tests or every 3 years of the liquid cytology pap smear. For those who are 65 years old, it can actually be discontinued if there had been adequate screening, meaning for the last 10 years, the pap smear results had been negative and there was no history of precancerous lesion or CIN. We also screen for sexually transmitted diseases like chlamydia and gonorrhea, specifically for those who are less than 26 years old and sexually active. For the older age group, we do it as indicated. So we include also in your Well Women visit your colon cancer screening, in which colonoscopy should be started at least at the age of 50 and repeated every 10 years, depending on the risk that your doctor could see in you. And for the blood testing for sugar, lipids, and the thyroid hormone, we basically start it at 45 years old, but even earlier if a person has more risk factors for this diseases. The mammogram is started at the age of 40 and should be done annually. For the bone mineral density, it is usually started at 65 years old and repeated every 2 years. But for those with risk factors, it can even be done earlier. So for immunization, like I said, we need to update all females of their immunization. And for the younger age group, we keep reminding them about the human papillomavirus vaccination and when they should do their tetanus, diphtheria, and pertussis vaccination. The flu vaccine should be given every year to all age groups for pneumococcus vaccine, we usually administer it depending on the comorbidities of the person. And HIV screening is offered routinely. Okay, so let me focus on the pap smear. Okay, the pap smear has been used for screening for cervical abnormalities and cancer, and has actually reduced the incidence of cancer by almost 50%. So this is what we do when we do a pap smear. We insert that small speculum inside the vagina, and we try to take a specimen in the transformation zone, and we then put the sample in the slide or in the specimen bottle, and that is read by the pathologist. So why the pap smear? Because cervical cancer has been found out to be the fourth most common cancer worldwide, but in the Philippines, at least 12 Filipino women die of cervical cancer daily, and it is the second leading cause of cancer among women between 15 to 44 years old. But with the proper screening, we can prevent the occurrence of cervical cancer. Like I mentioned, ideally we start screening at age 25, and if we do the HPV DNA testing, which is actually the preferred screening right now, it can be done every 5 years until 65 years old. But for the liquid cytology and co-testing, we can do this every 3 years. And the pap smear can be discontinued if the past 10 years of the patient was normal. And then, of course, we discontinue the pap smear if the patient has limited life expectancy as well. So let's now focus on breast screening test, breast cancer being the most common cancer among females in our country. We usually start doing the mammogram at the age of 40 years old, and it is done every 1 to 2 years, and even for the older age group. But for those with low resource setting, they raise the age up to 50 years old. But actually, for those with high risk, even at a younger age group, a pap smear can be done. A mammogram can be done. So this is what we do when we do the mammogram. So for women with a first-degree relative with premenopausal breast cancer, their annual mammography should be 5 years earlier or 5 years before the age of the relative when that person was diagnosed to have breast cancer. Okay. So I would like to discuss now about gynecologic ultrasound and its uses in gynecology and why we usually advise an ultrasound when you visit our clinic. So basically, we use it to evaluate abnormal uterine bleeding, presence of pelvic mass, or for any signs and symptoms of pelvic infection, as well as to check if there's congenital anomalies of your reproductive tract. And of course, if you're experiencing pain during menstruation or even without menstruation, and sometimes you use it to locate a lost intrauterine device. And of course, to screen for malignancy if a patient also is experiencing infertility. Okay. I would like to discuss about the importance of physical activity in prolonging longevity. It has been time and again, and we cannot overemphasize that physical activity is very important for all of us because it can improve your brain health, It helps manage the weight, reduce the risk of disease, strengthen the bones and the muscles, and improve your ability to do everyday activities. According to the International Menopause Society, these are the benefits of exercises or physical activity. It prevents weight gain and, of course, increase the lean body mass. And then there's less frequent occurrence of heart events, stroke, fractures, and even cancer. It also improves the metabolic profile, the balance, the muscle strength, the cognition, and quality of life. And definitely, exercise, the benefits outweighs the possible adverse consequences. In preventing cancer and a healthier body, this is the recommendation of the Center for Disease Control as to the kind and the limit of physical activity that we should be doing. So for almost all age group, the recommendation is at least 2.5 hours of moderate intensity aerobic activity plus muscle strengthening activities 2 days a week. Or it can be 75 minutes of vigorous intensity aerobic activity or an equivalent of moderate and vigorous aerobic activity plus muscle strength training activities 2 times a week. And the same would go for the older age group. So let us define what is moderate intensity aerobic activity. It's just like doing your brisk walking 150 minutes every week. And that would mean at least 30 minutes a day or 5 days in a week. And you should always include muscle strengthening activities that works all major muscle groups, including your legs, hip, back, abdomen, chest, shoulders, and arms. So why do we have to do this? We do this because we want to prevent osteoporosis and as well as sarcopenia, which is the loss of muscle mass as a person would get older. So what is brisk walking? Brisk walking is walking in a bit of a hurry. There's moderate effort. You can talk, but you need to take more breaths. Walking is good, but brisk walking is even better. So according to Spiroff, for osteoporosis prevention as well as sarcopenia, the recommended activities are the following: brisk walking, running, weight training, aerobics, stair climbing, swimming, and any kind of sports. So how can we incorporate physical activity or exercise in the workday? We can use measurement tools like the wellness app, and then we have to incorporate more activity into the regular workday. You can park away from the office and walk. You can have walking or standing desks, and of course, encourage the workers to leave their desks regularly, like every 30 to 60 minutes, and you replace the email or phone calls with personal visits, hold standing or walking meeting instead of sitting, and to use signs to encourage activity. And then, of course, providing access to fitness facilities. These are some of the exercises that we can do at work or while we are sitting down. So you can do your arm stretch, booty clench, ab twister, waist rotation, leg extension, no? All of this you can do while sitting down. Because according to the Women and Obesity Summit last year, the rate of Filipino women being obese is already 41.1%, and that is also one thing that we can prevent if we keep on moving. And the computation of being overweight for the Asia Pacific is different from the WHO. So as you can see, if your BMI is around 23, you are already considered overweight. And that goes the importance of food and nutrition. According to the CDC, consuming a variety of healthy food is better than eliminating one type of food, such as carbohydrate. So it's important to check the nutrition fact labels of all the food that you're eating and consider always the portion size. Counting the calories is not necessary, but it may help to see how many calories you need. So if you try to search, you can see this My Plate Plan. It is from the USDA. You can put in your age, your gender, your weight and your height, and whether you have physical activities. Once you do this app will compute as to the number of calories you need to maintain your current weight or to lose weight. And then when you click in, it will give you a recommendation on the kind of food that you can eat. So for fruits, vegetables, grains, proteins, and dairy. This will be very helpful for those who are trying to lose weight. Okay. Of course, it's important that we also do a food and beverage diary as well as do a physical activity diary. And I cannot overemphasize the importance of lifestyle recommendation, as we can see by the recommendation of the Society of Gynecologic Oncologists of the Philippines, that lifestyle factors have been linked to a variety of malignancies such as lung, colorectal, prostate, and breast cancer. So what can we do to prevent cancer? One, we have to avoid smoking, be physically active, maintain a healthy weight, eat a diet rich in fruits, vegetables, and whole grains, and low in saturated and trans fat, red meat and processed meat, limit alcohol, 0 is best, and protect ourselves against sexually transmitted infections, and of course, have a vaccination against the human papilloma virus. We also have to protect ourselves against the sun, and we should avoid tanning beds. And of course, get regular screening for the breast, cervical, colorectal, and lung cancer if applicable based on smoking history. So like I mentioned, we also would want to update the vaccination status of all women who would visit us in the clinic. So these are actually the recommendation from the CDC. So like I said, the influenza vaccine or the flu vaccine should be given for all age group annually. And then we update the tetanus, diphtheria, and pertussis every 10 years. We will also screen if the patient doesn't have hepatitis B vaccine and advise them as a way of preventing liver cancer as well. Okay. So I will now go to the perimenopause and the menopause. Why is it important? Because almost 1/3 of a woman's life is spent in the menopause. So in the Philippines, that will be around 10 million women who are in their perimenopause and menopausal years. So what is the perimenopause or the menopause transition? Those are the years prior to the final cessation of the menstruation. The average age actually is 46 years old, but it can start as early as 39 or it can last up to 51 years old. The average duration is 5 years for the perimenopause. So when do we say that a woman is in menopause? A woman is said to have reached the menopause if she has no menses for at least 12 months. Filipino Malay women have been reported to have an earlier average age of natural menopause of 47 to 48 years old. Okay. In relation to the menopause, we become more concerned about our skin. And I adopted this from the American Academy of Dermatology Association website. Important tips to reduce premature skin aging. What they highly emphasize is to protect your skin from the sun every day. So we have to use a very good sunscreen every day whenever we go out. And then, of course, it's better to do self-tanning than getting a tan. If you smoke, you have to stop. And you have to avoid doing repetitive facial expression. Because if you do that, you keep on contracting the underlying muscles and sometimes it becomes permanent. So wearing sunglasses can help reduce lines because it will avoid you from squinting. Apart from that, it's important again to have a healthy, well-balanced diet, drink less alcohol, and exercise most days of the week. You have to use only mild cleanser. No, you try to avoid scrubbing your face because any irritation can lead to accelerated skin aging. So it's important that you wash your face twice a day and after sweating heavily when you exercise. Of course, you have to moisturize daily and you have to stop using skincare products that can sting or burn because it means that your skin is getting irritated. And irritating your skin can make it look older. Okay. Well, this is Tweety De Leon. So don't we all wish that we are like her? She is 56 years old, a mother of 4. She's an entrepreneur, supermodel, and an actress. So sana all, right? Okay, in summary, health and beauty is skin deep. A reflection of what we are depends on what we eat, how we move, how much we rest and sleep, and how we take time to relax our minds through meditation and prayers. Our goal in our effort to lose weight isn't just a tinier waistline, but a healthier as the end point. These are my references for this lecture. And thank you very much for your kind attention.
All right. Thank you so much, Dr. Gloria. Well, a lot of those, I think, very, very well noted naman po by you'll see also thank you messages po in the chat for your excellent presentation po. Thank you so much, Dr. Gloria. We'll call you upon again during the Q&A. But before that, before we call on our reactor po, just wanted to make a few announcements lang po to remind everyone that for today's Q&A session, we encourage you to type in your questions po dito sa Zoom Q&A or in the comment section po ng ating Facebook pages or in the TVUP YouTube channel. So, dun po makikita po ninyo, there are those that have already typed in their questions and hopefully we'll be able to select those questions po during our Q&A. I've received at least 2 questions ready na po for our Q&A later. Up next is our reactor po, no? And really very, very thankful that we have another one from Asian Hospital and Medical Center to join us today. And she is very well known as an OBGYN specialist po at Asian Hospital. So please welcome Dr. Leonardo, Dr. Lenlen. Thank you po.
Hello, sir. Hello, Doc Raymond. Good afternoon.
Yes po. Good afternoon.
Everyone. Good afternoon, Dr. Ana Fe, Doc Dayon. I'm Dr. Lenlen Leonardo. I'm going to be reacting to my friend's presentation. It was truly comprehensive, no? All-encompassing from head to toe, 'di ba? For women. And marami rin akong natutunan or na-remind personally ako as a woman, no? From different age groups to different tests and activities, food and nutrition, may my plate pa na meal plan. So, kompleto talaga, Doc Raymond, no? And buti na lang hindi niya ako ginawan. Baka magutom ako. Meron pang nakalagay na skincare, bone health, mental health prevention, and maintenance. Pero na-note ko dito gusto ko yung WHO classification. Ayoko ng CDC. Magiging obese ako doon, no? All women will benefit a lot from this talk, and they should have written down notes actually. I'm thinking meron ba tayong recording nito? Kasi very, very comprehensive. They should go back on, the vaccinations, the tests that you should have done yearly. And also coming from a very empowered obstetrician gynecologist, Dr. Ana Fe Gloria, these recommendations are very timely and useful. And it's even more convincing because personally, I know Dr. Gloria, and she's the best example for these, especially when it comes to fitness and beauty. Doc Raymond, na-meet mo na ba si Doc Ana Fe in person?
I have not had the privilege, ma'am.
All right. That's why she's the perfect speaker for this women healthness and fitness. Okay. I just would like to note, I just wish that all women from all these age groups would have access to these tests. The pap smear, the mammography, transvaginal ultrasound, and among the other tests. And especially, Doc Raymond, the vaccinations, which is very important. And it's very costly, no? With our medical, wala tayong medical insurance, no? Like the HPV vaccination to prevent the cervical cancer, as Dr. Gloria mentioned. Do you know that currently we're only 5% ng target population pa lang ang vaccinated? And that's because of economics. It's very expensive. For those who are more than 14 years old, you have to have the 3 shots of this. For those who are below 14, who are very lucky to have the shots, 2 lang below 14 years old. All right? And then, syempre, meron pa tayong herpes zoster prevention shots for those who are 50 and above, pneumonia shots, and a lot more. No? So very important to note yung ating economics in this type of mga programs na kailangan natin as women. As women, we wear multiple hats as a daughter, sister, mother, spouse, partner, friend, and now we are health advisors. And it's very important na yung health and beauty natin and fitness is very well taken care of. Do you agree, Doc? If
Yes,
you're,
ma'am.
if you're married or have a sister and mother, yeah. But I would also like to include yung yung emphasize the economic considerations of this. Ideally, we should have the means and the budget to all these tests and vaccinations as women. And not only that, also yung mental health natin. Siguro in terms of beauty and wellness, meron tayong mga weekly na spa treatments, mani-pedi, little retail shopping, ganyan, bonding with our girlfriends. We do that all the time, si Doc Ana Fe. And also, she mentioned that there are a lot of inexpensive ways to do this. And dapat lang din madiskarte and maparaan, di ba? Yung mga hindi mo kailangan mag-join ng gym, hindi mo kailangan brisk walking, hindi naman mahal yun, no? Of course, yung emphasis on nutrition, and prevent yung mga vices. Dapat hindi tayo nagsusmoke. We only drink in moderation. Di ba, Doc Ana Fe? Drink in moderation. Also, meditation and prayers help a lot, no? Because being a woman is hard. What else can I say? Sir Doc Raymond, I would also like to stress and basically say to all our viewers na behind these empowered women, behind the empowered women, healthy and fit, both physically, mentally, and syempre spiritually din, no? Our partners. Husband ba yan? Boyfriend ba yan? Spouse? Also, very important, our family and friends who support and love us, that we may do all these things and more. So, congratulations, Doc Anafe. Thank you so much for this special opportunity to be your reactor. Medyo toxic, but I made it. Thank you so much for to everyone. Good afternoon.
All right. Thank you so much, Dr. Lenlen. Very lively po na reaction and something that really will serve us very well po mamaya po sa ating Q&A session. So right now we'll be diving into the Q&A session po, no? And I'm trying to scan if there are any questions that are in the chat that I may have missed. But what I'm seeing is that there are some here in the Q&A box na meron po tayo. Okay. Dr. Dion, did you want to go ahead with the first question?
Okay, so Doc Len, thank you for the reaction. Yeah, I think you've highlighted the very important issues and points covered by Dr. Anna Faye. So we'll start off with the first question here, and maybe we can expand it a bit, no? In terms of a healthy diet, and you mentioned about a well-balanced diet, but the question reads, what fruits and maybe vegetables are best to consume, maybe particularly for those who are in the perimenopausal stage or even post-menopausal stage?
Well, any kind of fruits actually is good because it's basically rich in antioxidants. But I guess the ones that are readily available here in our country would be your bananas, no? Whether it's whatever kind of banana you have, whether it's the saging na saba or the lakatan, no? They're very rich in all antioxidants, and maybe the ones that would be lower in sugar would be your watermelon, your melon. Of course, mango is good, but somehow the sugar is a bit high with eating mangoes. And for the vegetables, the best are the ones which are really the green leafy vegetables, no? Your pechay, your ano bang green leafy vegetables? Even your lettuce, just keep on.
Kangkong, talbos, mga ganun ba?
Yeah, exactly.
Kangkong.
Actually, what I advise my patients is dapat kalahati ng plato nila gulay, no? Ganun kadami dapat yung gulay na kinakain, no? And then a little serving of the meat, the carbs, and then of course, do not forget your fruits as your desserts.
Thank you very much. I think a follow-up question to that is, if you're able to maintain that kind of a healthy plate, would you be advising our women to take supplements? Because supplements would even cost
Side effects.
if you do it every day. And syempre,
Right.
meron silang kailangan i-prioritize na maintenance medications for hypertension, diabetes. Is it necessary to have those supplements?
Well, as the word would say, it's only a supplement. So it's not actually a treatment. So if you think you have a healthy diet, you don't really need a lot of supplements. But like for those patients who cannot even go out and have a dose of the sunlight, then maybe it would be best to take your vitamin D. No, because here in the Philippines, being a very sunny country, still a lot of women or people, no, or even men, no, are deficient in vitamin D. So if you think that if you're not taking a lot of calcium in a day because you need at least 1,500 milligrams of calcium, then go ahead, take that calcium. But if you basically are eating the proper kind of food, then you don't need a lot of supplements.
Okay, thank you very much, Ma'am Anna Faye. Dr. Raymond, do you have anything from the Q&A box?
Well, there's one here since we're on the topic naman po. And this one very interesting, just came in. In the modern age of dating, what are your experiences regarding women trying to keep their, well, I think maintaining their reproductive and sexual health Mas open po ba ang mga babae at lalaki sa mga usaping premarital sex, STD, or meron pa rin po bang takot when coming or when they're trying to consult with medical professionals?
Well, basically, for most of my patients, unless kasama yung mommy, nag-open up naman sila, no?
Hmm.
And since most of the patients right now would have their health card, so they gain more access to their OB-GYN. So they are very open, and actually some of the young age group would even advise for contraception before engaging in sexual relation, which I think is it's quite a mature way of uh, looking about or dealing about intimacy.
Okay, thank you. I'll throw this question out to Dr. Lenlen, coming in from Dr. Joseph Tortona. Ma'am, why is there apparently it seems like madalas na shortage of conjugated estrogen in the major drugstores? Di yata makabili ang mga patients ni Dr. Tortona. Ma'am.
Wow, pharma. Si Dr. Estela yata dapat sumagot niyan. No, ang mga conjugated estrogens, no, ever since medyo mahirap sila i-procure. And now we go for mga combined. Kasi for those, of course, it's not for everyone, especially for those who are very prone to cancers and the risks of it. So yung mga conjugated estrogens natin, I'm not sure about the yung distributor, manufacturer, pero ever since we had a hard time getting those Oo. So we go to the med reps.
Okay. So
Can,
yung po,
can I
Dr.
can I
Tortona.
can I
Yes, ma'am. Go
can
ahead.
can I say something about that? Right now we have the estrogel that's available. If you cannot find the Premarin,
Oral.
yeah. So it's a gel preparation. I think because there was scare about the menopausal hormonal treatment years ago. That's
Okay.
why there was very small sales of that conjugated equine estrogen. That's why maybe they pulled it out from the market. But right now it's coming back, and for now we have the estrogel, which is a gel type of estrogen that's available.
Okay, all right. Next question, but this one is related to the one that I got separately. Is it really worth it for those maybe in the 55-year-old and above daw po na age range to still take care of their skin in terms, and kasi madami na daw po siyang pinapahid or something. Is it really something that in the long run will be worth it, since I guess the question po is they're going into the elderly stage po.
Parang masakit yun 55 is quite young.
Yes, ma'am.
Of course, yes. At any age group naman, it's important to take care of your skin. And it's gonna be worth it. Just, basically put your moisturizer, put your sunblock, no, every day. It will still prevent skin aging. And of course, prevent you from having skin cancer, which actually it's not very common among us, no? That's more common in with the Caucasians.
Okay. Dr. Dion, do you have
Thank
anything?
you. Yeah, thank you, Ma'am Dr. Anne Faye. There's another question left in the Q&A box, and it's about still food. And they're asking if there are fruits or that are anti-cancer.
I don't think there's like one specific fruit that can prevent all cancers. So most of the fruits would have a lot of antioxidants. And there had been a lot of studies that, linking what kind, this, like maybe mangosteen to be preventing all these kinds of cancer. But it's important that we take a variety of fruits and not just one, because each of them would have different kinds of protection that can offer to us and to our body.
Okay, so there's no one pill to prevent cancer. It's really a more holistic approach, no, to healthier living, to limit our risk for cancer. So thank you po, Doc Ana. Do you have any more questions, Doc Raymond, for our panelists?
No more questions po. No? So, thank you so much, Dr. Ana Fe and Dr. Len. At this point po, we'll be launching our panel evaluation poll. So we're not sending out anything that's separate. If you can see here in the Zoom, there are 5 questions. It's a 4-point Likert scale. I'll read through the 5 questions, and we encourage everyone po of our attendees to answer po this evaluation poll, and hopefully we'll be able to gain a better sense of how you saw our webinar for today in terms of the topic and our panelists po. So the panelists demonstrated thorough knowledge of the topic. Number 2, panelists were well prepared and organized. Number 3, panelists spoke clearly and audibly. Number 4, the panelists used appropriate language and technical medical jargons adequately explained. And finally, the panelists contributed to new perspectives and knowledge on managing various key health issues. So we will not be sending a separate evaluation poll po. No? So ito na po yun. And hopefully we'll be able to get your results po towards the end of our webinar. Okay, for next week naman po, meron tayong, again, very exciting topic for all of you. Ano nga po yun ulit, Dr. Dion?
Nako, hindi ko rin alam, Doc Raymond. What do we have for next
I
week?
think we'll be having the geriatric division
Oh,
po, no? So
yeah.
we'll have updates in geriatric care from the director of Institute of Aging at the National Institute of Health, Dr. Shelly De La Vega, with reaction po from I think the PGH Department of Medicine for next week. Okay?
Very interesting topic. So
Yes.
watch out for that next week.
Thank you so much. So, before we conclude lang po our program, and we'd like again to thank very much our experts from the Asian Hospital and Medical Center. I'd like to take this opportunity po to greet po muna yung ating mga viewers kung nasaan po sila. Number 1, there are those who are watching us, well, locally from the Department of Health in Cordon, Isabela. I saw someone from Ilocos Sur po. La Consolacion University in Malolo City, Bulacan, Valladolid District Hospital in Negros Occidental, Inapoy Community Primary Hospital in Mabinay, Negros Occidental, Davao Regional Medical Center in Tagum, Davao del Norte, and Lebac, Sultan Kudarat. Ganyan po at kalayo ang ating mga viewers. Also, internationally, we have viewers from the Chonin Hospital, Taipei City in Taiwan, Lunichi Ali University of Blida 2 in Blida, Algeria, Canadian Medical Center in Dammam, Saudi Arabia, University of Hail in Hail, Saudi Arabia. So maraming salamat po. And you will see also on the screen, very well received po. No, mataas po ang ating score, between 93 to 99% po ang ating mga score. So just a testament kung ano po, how much they appreciated our webinar and our speakers po for this webinar this week po. We'd like to remind everyone that all of our webinars for all of our episodes, they are archived for viewing at the TVUP YouTube channel. So yun po yung tanong po kanina ni Dr. Len. So all of our 178 webinars, nandun po siya. And then after today, it will be 179 webinars po. We also have selected presentations. We feature them in maybe snippets po, no, found in YouTube Shorts. In that tab po, no, if you go to www.youtube.com/TVUPPH, or you open up your YouTube app and then go to TVUP na YouTube channel, you'll be able to see both our full archive webinars po and also our YouTube Shorts. Okay? So this formally closes po our webinar for this week. Magkita-kita po tayo again next Friday from 12 noon to 1 p.m. It's a date.
Together, we can stop preventable deaths.
So keep safe, keep healthy, and see you online.